and move to the subject of COVID-19. The Information Ministry is having its typical minister's briefing today. So let's take you live to the Information Ministry.
Aboagye, after 14 cases, they have 2 patients there. Twansi, yet to be operational, we have 70 beds there. They are yet to be operational. The Aboagye and the military are all empty beds that are yet to be operationalized within the next few weeks. Central region has beds in Cape Coast Metro, Trauma and Specialist Hospital, Dunkwa Government Hospital, and Jumaku Hospital. Of the 8 beds at the Cape Coast Teaching Hospital, 3 are occupied. We have 5 empty beds. Cape Coast Metro have 16 beds. There's no patient there now, so they have 16 empty there. We have the trauma specialists where they have, out of the 16, 12 are there, so you have space for 4. The Dunkwa Government Hospital, of the 24 beds available, 3 are occupied, 21 is empty, and the Jumaku Hospital is still empty. So in total, there are about 52 free beds that are there. We are also talking about an area of some of the infrastructure that is currently being upgraded. If they can show that. Okay. Now, we have the Dodowa site, which is currently, we did a visit there this week with the minister, about 80% complete. The building is completed. There's a rework on the flooring and the floors for modified area ongoing. Plumbing and electricity has been completed, and it's expected to be delivered by middle of July. And we are creating additional ICU beds in Dodowa to complement what we have. When it comes to there's also the remodeling and equipping of the Leeds facility in Ho. Currently, the total progress of work is 30%. The road works practically completed, awaiting the final seal, and the main building works is ongoing. So this is where you see the pictures. We have already equipment there in anticipation. We are also having the construction, isolation, and treatment facility at the Kolebu Teaching Hospital, which was mentioned the last time. The building is at the lintel level, and the payment requests have been processed for payment and currently are waiting to be processed so that it can be completed in time for us. We also have the rehabilitation of the Deborah ward, which is about 98% complete at 37, about 34 beds there. And we are currently testing the equipment so that it can be installed for use as soon as possible. Ghana Health Service had a learning center at Pantan. So we are converting half the accommodation section, which is about 55 beds, into an isolation center. It's about 70% completed. ECG is assisting us to convert the conference facility into a treatment center, and we are hoping that by end of August, those facilities will be ready for use. So, ladies and gentlemen, this is the summary. But I also want to add that we need to really follow the etiquettes, the hand washing, the social distance, and most importantly, the mask wearing all the time, as I keep saying. And don't remove your mask when you are talking, because that's when you shed virus if you are positive. So let's learn to use the mask all the time, at all levels. Let's all see ourselves as at risk. Don't see someone else at risk, but if you see yourself at risk, then you protect yourself and you protect others. So thank you very much. And we are hoping that our traditional rulers, our chiefs, our opinion leaders will all come into the campaign to encourage more people to abide by these etiquettes. The health can do its best, but we have to ensure that we protect ourselves and protect others. Thank you very much.
Dr. Aboagye, thank you for your updates. We're going to set up the microphone for some questions. Just to reiterate that as the voters registration exercise has started, and as we observe the exercise. There are many places in which EC officials and security and persons who are registering are doing their best to comply with the social distancing protocols. They are doing that by pre-arranging chairs that have been distanced properly. But there are also many other areas in which it is obvious from, for example, some of the pieces of footage that you are capturing that people are not observing the social distance protocols. We want to reiterate, security, electoral commission officials, and citizens, we all have a collective responsibility to observe these protocols even as we go about this registration process. May I invite our colleagues who have questions to step up to the microphone and to ask your questions.
Hello, I'm Yapeko from Atinka TV. I want to find out how many government infrastructure is being upgraded up the country and the cost involved. Secondly, there's been a speculation around that Sir John of the MPP party died of COVID-19. Can we confirm that from the government perspective? And we want to know the condition also of Peter McMahon, then Carlos Ahinkwan.
And who?
And Carlos Ahinkwan. Yeah, I want to know the condition of their status at the hospital as well.
Okay, thank you.
Good morning, Honorable.
Morning.
My name is Akokraba Kasapa FM. Just to add to what my colleague said, we'd like to know the health status in relation to coronavirus of Peter McMahon and, of course, Carlos Ahinkwan. And also, the Education Minister, Honorable Matthew Poku-Prempeh, would like to also know his health status as in relation to coronavirus. And thirdly, the President's sixth address noted that there was some absorption of tariffs, what is electricity and then water. We'd like to know, does the government have plans to extend those absorptions? Because just recently we realized that the Ghana Water Company Limited, they started with their charges and they ended the free water supply. So I'd like to know that of electricity. Thank you.
Thank you.
My name is Joseph Akabile. I work with JoyNews. The first question is, we have seen some countries reintroduce restrictions after they were eased and resulted in spike in cases. We spoke to the Ghana Medical Association this morning and they made that call, and we are asking that is the government considering bringing back the restrictions, specifically in the areas that the Director General describes as hotspots, the Ashanti and Greater Accra. The second is, how prompt is our testing regime? I've asked this question before, but we keep getting calls from people. I actually know people who took their test and their results came between 10 and 12 days, and they were actually positive cases. And in between that period, because they had been under the impression that if they are not contacted on time, it's likely that it's a negative case. So they were going about their duties and it turned out to be positive. And so on the average, if you take the test, how prompt will you get the results? And in terms of the testing capacity too, in terms of the centers, because I recall there were some private facilities that were carrying out tests that were asked to stop as well. Thank you.
Thank you. So let me take the ones that have to do with central government. Now I invite Dr. Aboagye to deal with others of a health nature. No, government has not extended the water and electricity reliefs. It was for a 3-month period, and I think that 3-month period ended a couple of days ago. Today will be the 2nd of July, so it would have ended a couple of days ago, and government has not announced an extension of same. In terms of the possibility of reintroduction of restrictions, I think we have always said that all cards are on the table. All cards remain on the table. His Excellency the President, in the earlier announcement to ease some of the restrictions, mentioned that this was a phased easing, which will be observed, and then depending on the lessons or the outcomes, decisions on the next steps will be taken. So all cards remain on the table. as the analysis goes on of how we have complied with these, may I say, bits of the easing, it will inform the next line of action. Should it be a reimposition of some restrictions in some areas or generally, or should it be further easing, will be all determined by the outcomes as we observe them moving forward. I do not have a brief on the health status of the individuals you have mentioned. I don't know if the Ghana Health Service will be able to share with us a brief. Dr. Aboagye, please step up.
Thank you very much. Well, I'll start with the individual questions on the health status of people. I think generally our policy on disclosure has not changed. As a medical profession, we don't talk about people's health status in public, but we encourage that because of the situation, anybody who is positive can make a voluntary disclosure, but we are not in a position to discuss people's health status publicly. It's against our ethical ethics. I could lose my license for doing that. So thank you very much. Currently, we are looking at about 12 infrastructural upgrades across the country. Some in the north, Zebila, I presented Dodowa one, I presented the Pantan one, and among others, the whole ones. Across the country, there are about 12 of them that is being upgraded. So, and that's where we showed you some of them. Maybe we'll visit and also take the media around to see the status of them. Currently, the upgrade in Kumasi South will be ready this weekend. That's my information. We are giving them some prefab from accommodation, and they have expanded to move to about 30 beds out from 18 beds, and then also adding some 8 ICU beds in Kumasi. That's currently ongoing. Whilst we are also looking at within a week or so, the Twaso one, that the one donated by Professor Frimpong Boateng, will be ready. Currently, the staff who will be managing the place are in training, and we hope that we also have catering services. Once those things are ready, there are beds, everything there, we'll move in there and start. Yes, we have experienced some delays in the lab. That is because we have had a few logistical challenges. The laboratory requires a lot of, for PCR, reagents, pipettes, all manner of things apart from that, and the test kits. It's a global scramble for them. So even sometimes when you have money, you don't always have one. But we know that by end of this weekend, we are having a consignment arriving, and so hopefully next week we will start ramping up the tests and reduce the delay. But the idea is that if there's a cost to take your sample, you are supposed to isolate yourself. If there's any reason to take your sample, it means that you are potentially positive. So until you hear your results, please try as much as possible to self-isolate. If the facility feels strongly that you might not self-isolate, that's when we have quarantine in isolation rooms waiting for your results. And so it's unfortunate, but we are working very hard to ensure that all the necessary logistics are brought in for us to get the labs running and doing. We are saying that ideally within 48 hours, you should get your results. And we are still working towards getting the necessary resources to ensure that we are able to deliver within 48 hours. For the private sector involvement, setting up a lab of that nature has regulatory and standard issues. Any facility that meets those regulatory issues, including the staffing, the environment with HEFRA and allied health, once you meet those criteria, it will be done. Nyaho has gone through that, and they've been cleared, and they are currently working with us. You also have to work within the pandemic rules of reporting lines. Because the pandemic, you have to report to surveillance, you need to report to the district in a way that the system can respond. And so it's important that those things go through, and then those labs. So any lab, private or public, that meets these standards will be important. Because we do that, we want to ensure that if someone says you are positive, it's positive, because the response is expensive. if you are negative, it must be negative, because if you are positive and you give you a false negative, you also create risk. And that is why the standards are to be maintained that once you meet those criteria, you are licensed to offer that. So currently, Nyaho is a private facility that is joined. The system is open. If you meet the clear guidelines, if you meet it, you can participate and assist the country test as many people as possible. Thank you very much.
Do we have another batch of questions?
My name is Sarah Paku. Dr. Aboagye, please, can you confirm if indeed testing had been stopped at all the supplementary laboratories apart from Noguchi, and why? And the president in his last address said that the EC was not going to share facility with the students who are back in school. The EC chair, Jane Mensah herself, also reiterated that. And now we are having instances where some school facilities are being used where students are being exposed to the virus.
Students have been exposed to the virus? How are they being exposed to the virus?
An example is at Aboagye. You can go there today. The facility, we understand, had only one gate, and people who are coming to register are sharing the facility with the students who are finding it difficult to have access to.
So contrary to what was said, some schools are being used as registration facilities.
Yes.
I think that's a fair way to put it. And your question is? My question is
that, has it come to your attention,
okay,
and what should be done to ensure they are not further exposed to the virus?
Okay.
Good morning, my name is Kojo from JoyNews. We are getting reports from health workers, especially in the Ashanti, Greater Accra region and the Western region, that more of them are contracting the virus and they still do not have adequate PPEs. So I'm drawing your attention to that, and what are you doing about the issue? And on Tuesday, you warned that there will be dire consequences if we disregard COVID-19 protocols at registration centers. As a medical doctor and a member of the Ghana Medical Association and the director of Ghana Health Service, would you advise that we put on hold the registration exercise? And you said you were not going to provide details of government officials who have contracted COVID-19, but I believe, or in the spirit of breaking the cycle of stigma, we need to know the number of government officials who have contracted COVID-19. My fourth question would be...
I didn't get your third question. You said what you believe.
In the spirit of breaking
So what is your question?
My question is, we want to know the number of government officials and who are they.
So, Doctor, can you tell us the number of government officials and give us their names? That's your question, correct?
Yes, okay. And their status, if they are responding to treatment or not. And then my last question would be, yesterday, CTFM, we reported that some Ghanaians who returned from the UK are complaining that the facilities provided for them for quarantine is not really helping their situation. So some of them have left these facilities. How are we tracing these people who have left? Thank you.
Thank you very much.
Good morning, Honorable Minister.
Good morning, sir.
Anapoku from the Research Light. Honorable Minister, the President did say that he is going to start paying the allowances of the health workers, and the issue that surrounding has been resolved. Is it going to pay all the arrears? And if it's going to pay, is it going to continue in case the disease rages on? Now, my second question, Dr. Aboagye, we are hearing some health workers have also contracted the disease. Can you give us the figures? And has this affected their psychology at working at the health centers? Thank you very much.
Thank you.
Good morning, Honorable.
Yeah.
If I'm Poku, if you can do my firm. My question is, you say for some time now you Busafa Madagascar for what you do now. Saying that Abaye to say on the Quapo Jimmy testing. Now, you're showing want to know the status. I can't say with the Madagascar. And again, for herbal practitioners, this almost Mundu Baya, the Coco Shishi Monoso, the Zimus, and so I can't say, Mudi, the bits me a fight, say, coronavirus.
That's it.
Good morning. My name is Eric Mawen. I work with Star FM. I'll start with a question that was asked by Nana on some allowances for frontline health workers. We know yesterday the Deputy Finance Minister was before Parliament. He mentioned that the Health Ministry was yet to submit names of these health workers to the Finance Ministry to facilitate payment. We want to know what is causing the delay in facilitating this process for the frontline health workers to be able to get the allowances. The second question has to do with a question also that was asked about specific lockdowns. You know, when the easing of the restrictions was happening, the President said that there was going to be monitoring, and as and when possible, areas are going to be locked down. The question I want to ask is, based on the increases that we've seen in a number of areas, have we reached a stage where we can lock down some of these areas? If yes, then we want to know the way forward. If no, when can we realize that in these localities and based on these projections, we have reached a peak where we need to lock down these areas? That's my question. And based on the increasing numbers that we've been seeing over the course of the weeks, I want to find out from the Ghana Health Service whether we have projections as to the numbers we are expecting to contract the virus in the country before we reach our peak and begin to decline. Whether we have projections based on the numbers that we're seeing. And lastly, on the registration exercise that we've been seeing, we've all seen where social distancing rules have been disregarded, persons are not adhering to the wearing of face masks and all that. Do we know the impact, or can we project the impact this is going to have on the COVID-19 cases we have as a country? Thank you.
Thank you. So we're going to take responses to these, and then I'll come around for the final batch of questions. I think there are only two for central government, and then the rest I'll go to Dr. Aboagye. Dr. Aboagye, let me just go over the questions for you. Is it true that there has been a halt or a stop of testing in supplementary facilities apart from Noguchi? There's another question about still concerns from health workers about the availability of PPEs, whether these concerns continue to come to your attention and what you are doing about them. There is a third question about whether or not you will advise as a medical doctor that there should be a hold on the registration exercise. There is also another question about, can you give us the number of government officials who have tested positive and their names and their status? There is a question about a report that persons who are in mandatory quarantine have on their own left the quarantine facilities. Can you confirm it? Has it come to your attention? And what are you doing about it? The extension of incentives to health workers. What is the scope of this extension of the incentives to health workers as announced by the President? There are reports that a number of health workers have been exposed to the virus. Do you have numbers? How is it affecting morale among healthcare workers? Have you received the Madagascar portion and tested it, and what is your position on it now? And do you have an update on the Ghanaian portions that were being touted? And then finally, is it true that there's a delay in the names of frontline health workers? If it is, what is causing that delay? How do you intend to work it out? And then the very final question, do you still have a model with projections and when we will hit a peak in this matter? I remember the last time this matter came up, we got into all sorts of controversies on it. But if you have any such, please do share them with us. Now, there are two questions for central government that I'll take. We will look into this report of a registration center at a school. This is which school? Bigbese? Okay, so we'll look into that one and draw the attention of the necessary authorities to it. And on questions of a possible set of restrictions, further restrictions, as I've mentioned, I will continue to observe the situation, and if we are of the view that some more restrictions should be introduced at a particular point in time, perhaps even some more stern restrictions, we'll do well to announce same. Dr. Aboagye.
Thank you very much. Testing has not stopped. We know that there's reduced capacity. Currently, the reference lab in Kolebu is testing. Noguchi is testing. KCCR has received their RNA kits, and so they are also testing. The VACDs, the veterinary services, even this morning, the CSR is also testing. So it has not halted. Even Noguchi has had a reduced capacity because of the shortage of certain supplies that they need to do that. So it has not stopped. Just that there are general reduction in capacity to test. And that is what is happening. Adequate PPEs. Yes, we continue to send in more PPEs to all facilities. We are looking at the distribution arrangements and ensure that managers too are also making them available. It has come to our notice, and we are also going to ensure that we look at the distribution and send in more PPEs, as I say. But I keep saying that when you are talking about PPEs, you need to define them properly. We have the masks, we have the gloves, we have the coveralls. They come in different quantities, and they are used in different circumstances, and so we need to also take cognizance of that. But we're taking note of GMA's concerns. We will take a second look and see whether there are any challenges with that and push the solution to that. Well, you want my opinion whether the registration should stop. I think I've answered this question before. They are very basic principles. You need to wear your mask. You need to do social distancing, and you need to wash your hands. Whether you are queuing to buy cocoa or whether you are doing anything, it's still, if you don't register, but you go and queue without your mask to buy cocoa, and the cocoa seller is also not wearing one, you could still contract. So the most important thing is applying the principles. If you go there, within the area where the registration is happening, the protocols are met. The challenge is the general attitude of people outside these areas that they are not abiding by the rules. I've been there myself. I've been to a few stations to see that when you get in there, the principles, the cleaning is being done. But people get there at 6 a.m. and queue, and they wait outside, and that is where the infringement is. And so we just continue providing education for people to be able to allow that. So my advice would be that in any circumstance, whether being in the office, in a space, or apply these principles, and that will be able to suffice whatever we need to do. Well, as I mentioned, I cannot really ethically tell you all these numbers and you want names and their status. It cannot be done. I'm sure there are media men who have also been exposed, and we don't have their numbers. We don't have their names. But those who came out did that voluntarily, and that is what we encourage. We are not going to be able to ethically mention anybody. Yes, I'm aware of the facility that some people had left. The matter was that 2 days ago, a batch who had received their samples were discharged by the district director of Kole Krote. Yesterday, they were discharged. As to how people came up with the information that they walked away, I don't know. They were all officially discharged. Based on our current discharge policy, you don't need a second test to be discharged. And so they were officially discharged. And that is what it is. Yes, health worker, if being affected is a key concern for us. That's why the issue of PPE availability and appropriate use becomes part of the core thing that we are driving. As health workers, it's part of our risk that we are here. And as media men, you are here every day, isn't it? Knowing that we are in a group, of course, we are practicing social distancing. So, health workers, we have had to face Ebola, we have had to face HIV, we operate people. So there's a risk is inherent. And so we continue encouraging them and protecting them. And we know that that's what we have also sworn to do. And that's how we continue to encourage those who are still working at the front line. You go to the treatment centers where you know there are positive people there, but you see health workers go and treat. So we are wary of the risk, and that's why as health workers we do that, and has really not affected their performance, and we continue to encourage them to do what they are doing. We've really not had any performance because it's part of our work, and we want to celebrate them for what they continue to do as we fight this pandemic. Well, on the areas of the herbal practices, preparations, I believe that we have a process. You bring your herb, you go to center, one point, you go to FDA, they get it tested. The same procedures that other herbs are in the market officially being sold, it goes through the same thing. But let's also be cautious that if you have been following the net, I'm sure you have seen what's happening in Madagascar already. And so these are the reasons why we need to go through the process to say that whatever herb you are saying, it does exactly what you say it does. And so we don't just, someone say, I have a dream and I have a medicine, and let's say no. You go through the process to make sure that if I take it, I'm safe, and that it does not affect any other parts of my body, and that it does what it's supposed to do. So those processes are there, and once you meet those processes, it will be registered, just like we have many other herbs in the market are already working. The allowances for health workers, yes, we're doing them month by month because not everybody works everywhere. The systems are ready. It is being submitted to the Ministry of Finance to look at it. But we said initially there were discussions with the unions and the staff to see who is really her frontline staff, and that caused a delay. Now we have resolved that, and so the names are being sent to Finance for payments to be done. Yes, projections, we do projections, but I keep saying that's for planning purposes, and that's how you help us in planning our strategies. Where it's possible, we will share, but our emphasis is to ensure that we reduce the spread, and those are the issues we want to talk about. Honorable Minister has talked about the lockdown. There are basic principles. If you have a surge somewhere and you put in certain measures like isolation, etc., and you're able to contain it, there's no point in that unless there's a persistent escalation. And in any places where we've been able to put in some of these quick measures, we've seen results. But like I said, we continue watching where there's a need to do. I think the necessary advice will be given for the appropriate authorities to take the decisions that are needed. So I think that's what I have for you. Thank you very much.
Colleagues, is there a final batch of questions? Is there a final batch? Yes, sir. Say again. It is valid for the period during which it was announced. So colleagues, will be drawing down the curtain here. I think if you notice that we have a very somber mood this morning, you all do know the reason. I think late last night, the death was announced of Mr. Kwadwo Osefri, or Lawyer Kwadwo Osefri, or Sir John as we call him. And this morning our thoughts are with the family, with the New Patriotic Party as a political group, and with the people of Ono, as he always likes to speak up for them. We'll also continue to generally make the point that, yes, you see the cumulative case count going up, but it is because there are still a lot of people who are not observing the necessary preventive etiquette. And when you have an opportunity to interview them or to speak to them, whether in ECQs or wherever, let's not just cut it and play it up that, oh, look at all of these people not observing. It's an opportunity for us also to participate in the education and the caution while at that, as part of our civic duty. And hopefully together we can make some success in this enterprise. We thank you for your time. God willing, on Tuesday morning, we'll reconverge.
Information Minister Kojo Nkrumah there, ending today's Minister's press briefing with a word of condolence to the family, friends, and the MPP fraternity of Kojo Osei-Free, a former General Secretary of the party and Chief Executive of the Forestry Commission. Now, of course, Mr. Nkrumah spoke, Dr. Patrick Kuma Aboagye spoke. Dr. Aboagye, among other things, revealed that there is a challenge with the supply of reagents and logistics needed for the testing of Covid-19, and as a result, there has been a delay in the test results of some persons who have tested already. He, however, advised that if your sample has been taken for a test, then it's necessary that you isolate yourself so that you and your loved ones can be kept safe. Fred Smith, who is the head of our health desk, spoke to us this morning on Prime Morning, and he had a lot of words to say about the fact that he tested and his test results took about 10 to 12 days to come to him. And so he was moving about with confidence that he was negative. That is not the case. If you've tested, please stay safe.